Come in. All right, we have some people trickling in. Welcome, everyone. I think we'll give it a minute to see how many folks. Give folks a minute to join. The number is growing, which is great for everyone here. I'm going to put some stuff in the chat. Let's see here. Cool, great. So, hi everyone. Thank you so much for joining us today. My name is Melody Martinez. I'll be your host for this session. And while we wait for folks to trickle in, please just take a moment to introduce yourselves in the chat if you'd like. We'll be starting in just a couple of minutes while we wait for a few more people to join us. You can share your job title, organization or school, city, state, or country from which you're joining us. Of course, all sharing is optional, so just say hello. And we'll be starting in just a few minutes. I see more people coming into the room. This is great.
Oh, cool. I see some names I recognize.
Yay!
Glad to see y'all here.
Yay! Hi, Jenny from Oregon Humane. I'm also in Portland. Nice to see you. Oh, yeah, I see some recognizable names in here. Hi, Irene, I see you. So great to have folks here joining us. We'll give folks another minute and then we will get started. Hi, Naomi. Nice to see you here. Wonderful. All right. Okay, so folks will keep coming in and we'll just make sure that folks keep saying hello. And like I said, if you want to introduce yourself in the chat, let us know where you're coming from. That is always wonderful to create a sense of community, see where people are coming from, see what organizations are represented. Ooh,
Oh,
hi,
cool.
Lisa. Very cool. Uh, Dakin Humane Society. Hi, Katie. Nice to see you. Wonderful. All right, let's get started. So welcome everyone. Thanks again for joining us. My name is Melody. I am the Executive Director for the Multicultural Veterinary Medical Association. For those of you who are new to us, to MCVMA, our mission is to lead veterinary medicine towards the racial and ethnic diversity, equity, and inclusivity that our profession needs to serve a multicultural society. So we envision an equitable and inclusive veterinary profession where people of underrepresented races and ethnicities are valued and supported in their careers, resulting in all communities receiving the benefits of veterinary medicine. You can learn more about us and what we do at our website at mcvma.org. I'll put that in the chat in just a moment. We're also very grateful to be able to bring you not only this series of webinars, but open access to the Elsevier publications on DEI that we'll be highlighting throughout the webinar series. And all of that, both the open access publications and this webinar series Beyond the Page, are made possible by a grant from Maddie's Fund. So we'll also share Maddie's Fund if you're not familiar with Maddie's Fund. We'll also share that in the chat in just a moment. And where we have a few reminders before we start. So the session is being recorded and it'll be available for viewing later on our YouTube channel. We'll also send the link out after the event so that you'll have access to that right after this event. We have a few items of housekeeping. One is please use the Q&A feature in your menu bar and not the chat to ask questions so that we can track questions and so that other attendees can upvote questions that they want answered. We have time for a Q&A at the end, but may not be able to answer every question this evening, just due to the amount of time that we have. You can also turn on live captions and translated captions in this webinar. Just go to the captions feature in your Zoom menu bar, which should be below this video if you're on a computer or tablet, and click on Show Captions. Click on the little caret in the top right corner of that button to choose your preferred language. And if you need any help, just please use the chat to request help from us when you need that. And again, I'll put those instructions in the chat right now as well. All right, let's get started. So our guest tonight is Dr. Sohaila Jafarian. Dr. Jafarian is a small animal veterinarian with a master's in public health. She's a PhD candidate in social work at Colorado State University and brings a unique interdisciplinary lens shaped by her work in community and shelter medicine, veterinary social work, and community-based participatory research. Her work centers on the sociological, economic, and cultural factors that shape access to care and the human-animal bond, as well as the experiences of marginalized communities within veterinary medicine. Welcome, Dr. Jafarian. It's an honor to have you with us this evening.
Thanks so much, Melody. I'm really excited about this tonight.
Thanks. And just for folks here, I will refer to Dr. Jafarian as Dr. Jafarian, but we know each other through our work together at MCVMA. So if I slip up and call her Sohaila, it's because we know each other personally. All right, wonderful. So let's get into some of these questions. So let's start by giving the audience here a brief overview of your chapter in Elsevier's Veterinary Clinics, Small Animal Practice, Diversity, Equity, and Inclusion in Vet Med. I know that you wrote in both part 1 and part 2, but today's session is about your article in part 1, and I want to go over some of those key points that you discuss. So your chapter is titled The Value of Qualitative Research in Diversity, Equity, and Inclusion. Take us to the heart of your chapter for folks who may not have read it yet. What do you hope readers of your article understand?
Yeah, so I would say my researcher heart hopes that this research methodology is seen as legitimate and necessary for understanding and improving the work we do, no matter what we're doing or what field we're working in, at what level. Gaps in research and understanding are inherently more difficult to understand with quantitative techniques. So using numbers, using statistics, you lose a lot of nuance there and understanding of human experiences. And that is because we are dictating what questions are asked instead of letting people tell us what is important. So what questions are we not asking? Whose voices are not being heard? We simply don't know what we don't know, right? But I would say my advocate heart, my human heart, also wants everyone to understand the importance of stories. There's this paradigm of social constructionism, which teaches us that our understanding of human beings is constructed through thought and language and interaction. How we talk about and describe people shapes our reality in ways that can either include, exclude, harm, or heal, right? Um, Anyone who has spent any time with me knows I am a little bit obsessed with the work of the author and scholar Viet Thanh Nguyen. He talks a lot about how American culture tends to foreground certain experiences and voices, and most often those voices are white, right? And under these conditions, the stories of minorities and marginalized populations aren't told often enough. And when they are told, they're often distorted or exploited, right? We tell stories to make sense of the world, but when you have this dominant culture dominating the conversation, voices are lost. He talks a lot about when he was young, he's a Vietnamese refugee, and he became obsessed with Apocalypse Now of all movies, right? And that movie, there is only one Vietnamese person with a notable speaking role. And I don't think they're even credited in the movie, right? So he speaks a lot about the Vietnam War, which in Vietnam is referred to as the American War, right? But an American movie about the Vietnam War is seen all over the world. But a Vietnamese movie about the same war may be seen in Vietnam and probably nowhere else. And he has this beautiful salient quote in one of his books that has stuck with me for years that says, not to own the means of production can lead to a premature death, but not to own the means of representation is also a kind of death. For if we are represented by others, may they not one day hose our deaths off of memory's laminated floor? So, like taking these two sides of my heart together, these ideas make the case for qualitative research, not just as a methodology, but also a moral commitment to knowing people fully.
Wow. Yeah, this is great. So this goes beyond just gathering stories for story's sake, but really about the representation and the ability for people to have the agency to tell their stories, right? That's wonderful. So you just mentioned this a little bit, and you described quality in your chapter. You described qualitative research as capturing the lived experience of a group for a profession trained to trust statistical metrics like p-values and sample sizes. How do you make the case that a rich narrative or a set of interview themes is just as rigorous and trustworthy?
Yeah. So a really common misconception that I see, and not just in vet med, but broadly, is that qualitative research is easy, right? You just collect some stories and you write that up. But that's simply not true. There's this enormous amount of scholarship for every kind of qualitative research, and there is, just like in quant research, there's a million different ways you can do qual research. So grounded theory, ethnography, discourse analysis, thematic analysis, all of these different ways of conducting research that all have their own best practices to establish this reliability and validity. So qualitative work is not subjective, but it does follow these systematic procedures. So generally, any trustworthy study requires a thorough, well-cited, transparent, and justified methodology, analysis, and reporting, whether that be qual or quant. So ultimately, I see qual and quant research as equally valuable, and that is something that's often forgotten in these discussions, right? Quantitative research may be numbers and statistics, but every choice in a quantitative project is a human decision, and thus it is subject to human bias, right? We are all biased creatures doing this. And again, I don't see one as more or less legitimate or rigorous than the other. I see both as requiring that established methodology, a deep look at ourselves and our own biases and what we want out of the studies we're doing, what our goals are. And most importantly, in my mind, is for consumers of research to read research with a very critical mind and looking at those aspects. Are we seeing all of the, is the methodology clear? Is it justified? Does it make sense? So that is my argument for it. I think both have biases and both have biases that need to be mitigated.
hmm hmm Yeah, you're candid about the weaknesses of qualitative research in your paper. Subjectivity, researcher bias, premature theorizing, some of the other things that you just brought up. How do you respond to colleagues who use those limitations, right, as a reason to dismiss the methodology altogether rather than as problems to be managed?
Yeah. And again, circling back that like quant research is not infallible either. Like I think we unfortunately saw that with the NAVTA white paper, right? That was majority a quantitative paper that silenced the voice of the few marginalized participants that did fill out that survey, right? And broadly, even in quantitative research, like let's take the p-value, right? The p-value has been this measure of is this result significant or not for decades at least. But there's a lot of debate in the broader research community on the p-value because the p-value only answers the question, is this effect real or is it random chance, right? But it
hmm
doesn't tell us how big is this effect? Is it relevant in the real world, right? Is this clinically relevant? Is this relevant in whatever we're assessing, right? And these two things are not the same. So we're talking about significance and we're talking about effect size. And a significant result doesn't mean the effect is large, and a non-significant result doesn't mean that the effect is small or absent, right?
hmm
So you need both pieces of this information together to really understand what any study is telling you. And that's why a lot of scientific fields and A shout out to the psychological stats professors at Colorado State who drilled this in us. And again, not something I had traditionally heard of either, but you need to look at effect size with p-value to fully understand the relevance and the results of any study. And that is now considered an essential for good quant research. And that is something I'm not seeing much in the quant research in vet med either, right? So that's not saying that we're wrong and or we're bad or anything like that. It just means that again, both have weaknesses that need to be mitigated. And like everything else in life, we need to be constantly assessing how we're doing research, how we're reporting research, how we're understanding research. And again, I think what is often lost is that qual and quant are very complementary and they can work together and they just provide different understanding of phenomenons, right? Do we want to build a graph or do we want to tell a more colorful story? But it's still legitimate research that gives us useful information for the practice we're doing.
Yeah, yeah, thank you for that. Yeah, I can really think through like those papers I've read where the quantitative research has asked and led me to ask questions that I was like, oh, this seems nuanced. I want more, where a mixed method would have been really useful in understanding the meaning of those numbers, and the meaning of the making meaning of how effective something was or wasn't,
Yeah,
right? Um,
absolutely.
Switching gears a little bit, in your article, you talk about epistemic violence. It's a term that may be unfamiliar, or even feel charged to many veterinary professionals. How do you introduce that concept to someone who pushes back or who doesn't think they're hurting anyone? And if you could like describe it for us,
Yeah.
in the room here, and then answer that question. How do you introduce that concept to someone who doesn't think they're causing harm or who might push back?
Yeah, absolutely. And understanding epistemic violence, we have to take a step back. Like, what is epistemology? And that is the study of knowledge. What is knowledge? What does it mean to say that someone knows or doesn't know something? And epistemic violence is this erasure or dismissal of marginalized communities' knowledge and lived experience by systems, by dominant culture that deem their ways of knowing inferior. So, not just silencing their voices, but also their very capacity to be recognized as knowers. There's this fantastic paper by Moria Perez, and I will paraphrase. She explains that epistemic violence is not this violence in the way that we understand it, right? It's not physical violence, it's not obvious violence, it's the slow, silent, invisible, insidious violence, right? And that means it doesn't require bad intent. Like a lot of things don't require bad intent to cause harm because it is structural.
Mhm.
So it is structural in the way, again, of whose expertise gets centered, whose observations get dismissed, what counts as evidence, and most importantly, in my mind, of who gets to name what's wrong and what harm is being caused, right? And epistemic violence as a structural phenomenon is a very key factor to understand and is not recognized, right? In systems of privilege such as racism and sexism and ableism, it is in fact strengthened by its imperceptibility and its insidiousness, right? Because it is not something necessarily always solid that you can directly point at. So it is important to recognize that. It is important to separate intent from impact. And it is important to understand that you're not accusing someone of active intentional malice. It's pointing out that systems and habits can silence people and harm people even when you're trying to help by not understanding how these more invisible structures work. So, doing any type of this work is about recognizing and overcoming these exclusionary systems and not letting our individual defensiveness or hurt feelings to stop one from doing this work. It's understanding that we are all carrying biases that are seeded and shaped and strengthened by the society we're living in. I often explain to people, and I do not mean this in a demeaning way at all or a littling way, but like most of us are in animal welfare in some capacity, and we understand puppy and kitten socialization, right? It's what we introduce them to. It's how they understand what is safe and what is not safe, what is quote unquote normal, what is not normal. And human beings are socialized in very similar ways as well. We don't have that narrow socialization window, but we do have socialization windows. We are socialized to the society we're living in. So we have to understand and take accountability for that and accountability for our complicity in these systems. Inequality is man-made, and that means it can be dismantled, and it's our responsibility to do so. Um, I'm quoting a lot of people tonight because there's so many people doing incredible work, but Orotundi Roy, a quote I love from her is that there's really no such thing as the voiceless. There are only the deliberately silenced or the preferably unheard. And that's what we need to be thinking about, right? Like if we get defensive about the term epistemic violence or epistemic silencing, are we hearing that voice though? Is that a voice we're hearing much, right? Are we hearing much from Iranian voices? Are we hearing much from Iranian pet owners, right? We're not. And so those are voices that are there, they're present, they exist, but we're not hearing from them. There is no platform for them to be heard. And again, separating that distinction between impact and intent.
Yeah. Yeah. So great. This is one of my favorite Arundhati Roy quotes. And I was thinking while you were speaking about, you were saying about, how we're all socialized, right? And I was thinking about the part in your article where you talk about even epistemic violence can be invisible to the people who are being studied or who the research is about, right? And so it's that insidious that you can be reading it, you can be thinking, look, participating in it and not realizing that your own knowledge is being questioned or silenced, right? And I think about that too as it shows up in our community medicine settings, in our practical settings out in the community, clinic settings where we question what the pet owner knows about their pet's illness or what their pet's behavior, or we minimize the knowledge that they come asking, to us with asking for help, right? So I think about the ways it shows up, not even just in research, but just in how we are with one another, what we believe to be true about the people who live with that dog, right, or live with that cat. So
And
such a
like what we believe about ourselves too. I had right before I left New Mexico, I made new friends, which was sad right before I left, but they're wonderful women. One is an OBGYN and one is a pediatrician. And the pediatrician told me something like really fascinating in that she started practicing in Rochester, New York, which is a very wealthy, upper middle class white community, and moved to Albuquerque within the past couple of years. And she was like, I almost said pet owners, the parents in Rochester, New York, they would come in, they would say, like, okay, this is my plan for my child, like developmentally, medically. And she was like, my job pretty much was to be like, yeah, that sounds great, or I have some concerns and let's talk about it. And in stark contrast to her patients in Albuquerque, where they would come and they would say, tell me what to do, because they didn't trust their cultural knowledge. They didn't trust what their families are doing. And New Mexico is the 48th poorest state, and it is a majority minority state, and it is actually shocking that contrast between what she was seeing within her parents that she was dealing with. And I think that's an important thing to understand too, is we also diminish our own knowledge because we don't see our own knowledge being valued in that way.
Yeah. Yeah, such a great point and such a great antidote to talk about what epistemic violence looks like, right? And to kind of flip the other side of that, right? Community-based participatory research, which you do and you have talked about and you wrote about in this paper, that research, that type of research asks us to move from studying about communities to thinking with them. In a profession where most of us are trained as the expert in the room, right? What does it actually take practically and psychologically to make that shift?
And that is hard. That is a really, really hard shift. And that takes a lot of cultural humility and just humility in general, I believe. And cultural humility is this ongoing commitment to examine and not have this tight grip on your assumptions of the world, right? To position yourself as a learner rather than an authority in any encounter, and to recognize that every person you meet is the foremost expert in their own experience, right? Like that pet owner is the expert in their pet, right? They know that pet better than you, that is for sure. And they know that pet better than anyone else. And it's important to recognize that and to sit with that. Um, and this means this is a lens that you view the world, but also yourself. And you're constantly coming back to again and again in every single interaction you have. It's leaning in when something makes you really uncomfortable or defensive and asking yourself, why is this making me so uncomfortable and defensive? There's this fantastic paper based on social work education, looking at cultural humility. So moving away from cultural competence of like, I can reach this endpoint where I somehow have knowledge on every culture that walks the earth, right? To this cultural humility framework, right? Of understanding oneself on a deeper level and also looking at power and privilege in a deeper level. And what I really like about this paper, it does a lot of things really, really well. And I don't think I mentioned the author. It's Fisherborn and all. And I'm happy to share all my resources I'm referring to tonight. But they present a list of questions to be asking oneself for critical self-reflection, as well as questions to address power imbalances, right? And they have other questions, but I'll stick with these for tonight. And what I really appreciate about these is they are like very simple, right? So questions to be asking oneself often is how does my own background help or hinder my connection to my clients or my community? What are my initial reactions to clients, specifically ones who are very different from me? How much do I value my input from my clients? How do I make space for clients to name their own identities and what is important to them? What do I learn about myself through listening to clients that are different than me? And ways to address questions to address power imbalances, such as what are social and economic barriers that impact a client's ability to receive effective care? What are specific experiences my clients are having that are related to oppression and or larger systemic issues, which is a piece that has been missing in veterinary medicine historically, right? And how do my practice behaviors actively challenge those power imbalances and involve marginalized communities, right? I think that
These are
is a good place to start. Right.
these are fantastic questions. I already see that in the Q&A we have someone asking for the link for this list of questions. So
Yeah.
maybe you all will get a copy of this video after this session. I think either like later tonight it'll get sent out or tomorrow. Maybe Dr. Jafarian, we can include some of the links to some of these papers that you've cited and some of these, especially that one,
Yeah,
in
absolutely.
that so folks can have those resources. So you drop in your paper, you drop a sharp distinction, and this is kind of related to that, right? Like w when we don't ask those questions, when we're not doing that internal work, right? We're more likely to not know what we don't know and cause harm, with and intentionally or unintentionally, right? And so you draw a sharp distinction between damage-centered research, which documents suffering but ends up pathologizing communities, and humanizing strength-based research. What would I mean, please let us know what is that distinction? How can folks in the audience who haven't read your paper yet understand the distinction between those two things? And what would a strength-based research question look like in veterinary medicine as opposed to the deficit-framed version we might default to?
Yeah. And in a nutshell, moving from deficit center to a strengths-based research is moving away from what are they doing wrong? What's wrong in these communities? What are they missing, right? What are they deficient in to what are they doing well? What is working well for them? What is bringing joy to that community? What is building resilience within that community, right? There's a great paper by Sean Harper that I cite in the chapter and happy to share as well, titled An Anti-Deficit Achievement Framework for Research on Students of Color in STEM, um, who describes a lot of questions I would love to ask BIPOC veterinary students, so minority veterinary students, right? And in this paper, he outlines traditional deficit focused questions and how they can be reframed. And again, this is within the STEM framework. So asking questions, not why do so few minorities pursue STEM majors, to what stimulates and sustain minority students' interest in attaining degrees in STEM fields. Deficit of why are they so underrepresented in college level mathematics and science courses, to how do STEM achievers from low resource high schools transcend that academic unpreparedness and previous educational disadvantage, right? Um, what sustains BIPOC veterinary students through their career, right? Not just through vet med, but through their entire career. How do they get from A to B? Like I know I had a lot of hurdles in vet school, but I also had a lot of strengths and I had community and I had a lot that I was bringing in with me that got me through. And another aspect I personally am deeply interested in exploring is cultural strengths of pet ownership. There are these persistent and deeply harmful stereotypes in vet med about BIPOC pet owners, right? That they don't form loving relationships with pets, that their culture is actually incompatible with loving animals, like it's not possible for them to be loving animals, and that culture is a barrier to them for pursuing and receiving veterinary care. And we both know this is not true, right? And it has also been disproven in the literature, but it is something I still hear all the time, and I know you do as well, right? Like, oh, well, they just don't believe in taking their pet to the vet, and not there's this long history of abuse and distrust. And, veterinary medicine is this scorpion field, right? And human medicine has also caused deep harm to these communities, and those harms get melded together, right? And, we have never asked what cultural strengths are to pet ownership. Instead of measuring clients against this single standard of correct pet care or correct loving of an animal, asking what knowledge, value, relationships, and practices is this person bringing in that I should recognize and build on? Are there cultural strengths to pet ownership? Is there intergenerational and community knowledge? Like my PhD cohort mate, Jada, is a Black woman, and she talks a lot about this. She was in a rural community in the South, one veterinary clinic that treated everyone who was a minority, which was few people, terribly. So they relied on each other. The minority community relied on each other to share pet care knowledge because it was that harmful to step foot
Mhm.
in front of a veterinarian. They did it when they had to, but they really did not want to. So, what is that community knowledge? How do those community knowledge networks work? Are there different kinds of relational bonds, cultural practice, or spiritual beliefs that we are unaware of? And again, I don't know the answer because we're not looking at it at all. And the research that has been done thus far is, things like pet attachment scales, that sort of thing, are all based on white ownership. I have this personal pet peeve with that Ronnie Elmore paper. That was a commentary, but it is still quoted as if it is research. Um, and there's not a lot of citations in it, but every single one is miscited. And he quotes a couple studies on pet attachment scales, but when you go to those actual studies, they actually do a very good job of explaining these scales were developed on upper middle class white owners, and that we cannot brush with a broad stroke this to every culture, every people. One of the biggest aspects of one of the pet attachment scales was whether or not your dog slept on the bed.
Hmm.
Like, I am deeply bonded with my dog, but my dog doesn't sleep on the bed. And that is simply because he's a long back, short leg dog. And I'm worried about his little back and IVDD. And I'm a little bit of a paranoid pet owner. But, like, does that make me a bad pet owner? Does that mean I don't care about my pet? And we're making these broad claims about, oh, they don't let animals sleep on the bed, so they don't love their animals in the same way we do. They actually don't love them. And that's why there's not less BIPOC in vet med. That's it. What can we do to fix that, right? So
Yeah.
it also takes the responsibility off of us in the field to make it more inclusive, right? Because then we get to put the responsibility onto them.
Yeah.
It's their fault because they don't love pets in the same way we do. When, I would hazard to say the love is there and it's very deep. It just looks differently from yours. And that doesn't mean it's right or wrong.
Right. Right. Yeah. I keep thinking this. You should tell this to my dog. She's not allowed to sleep in the bed. And it's not because she doesn't make her way in. It's because she gets aggressive if you move her. She's 10 pounds, but if you adjust your body in any way, the growling and the biting starts. And so it's for the love of my sleep and her sleep and my partner's sleep that she sleeps not in the bed. We love her very much. We want her to have a good night's sleep. We also want to keep our toes safe. So
Yeah.
that's part of it. I love that. And this is interesting. You're saying like there isn't a lot of that research isn't the qualitative research isn't there. We're not asking the right questions. We're not looking at strength-based research, right? We're not seeing a lot of that qualitative research in veterinary medicine. And so this next question is about a little bit about that. Vet med is a field where quantitative research dominates. We've established that. What gets published dominates what gets published, funded, and taught. What are the real barriers that qualitative researchers face when they try to get this kind of work into peer-reviewed veterinary journals? And what needs to change on the editorial and institutional side to lower those barriers?
I mean, a big thing is lack of experts and thus lack of mentors. I was extraordinarily lucky, and big shout out to Brittany Watson and Chelsea Reinhardt at Penn when I was an intern there. And I was like, I don't even fully understand what qual research is, but I'm interested in doing it. They were like, that is wonderful. We will support you. Dr. Watson, she was like, I've done some qual research, but I'm not an expert. They acknowledged that and they supported me to the end. They sent me to training camps at Penn. They paid for so much training for me. They provided me time, they provided me grace to learn what to do it and to implement it. And they were the first, and until I started my PhD, the only people to give me that space to do qualitative research in vet med. Obviously, Christina Trang gave me the opportunity to write these chapters, but as far as like my first crack at qualitative research, getting the opportunity to train in it, getting the opportunity to conduct it, like that was on Brittany and Chelsea, and they acknowledge like we know what this is, we have dabbled in it, but we don't have the knowledge to be able to train you to do this. And they gave me the space, the opportunity, the funding, all of it to do so and to fall in love with it and become obsessed with it, right? Um, but that is a very, very unique opportunity that I had, and a very unique situation. There are also very strict journal requirements in veterinary medicine, in our journals that really inhibit qualitative research. The biggest thing is the word limit. So they have very
Mhm.
strict and tight word limits, which makes sense for quant research. But in qual research, when you're trying to paint this picture of this lived experience of a group, you need words, right? So a 5,000 word limit is just not going to cut it. And a lot of journals lack reviewers that are trained in qualitative research and don't have the capacity to learn it to assess a handful of papers, right? There's also a lack of legitimacy, right, in the field, and there's a lack of motivation. It's not seen as important. We care about the animals, we care about the medicine, and we have this culture of not caring about the people, not caring about the pet owners, this culture of, I would say, disdain or even hate towards pet owners. And I think that has developed out of a defense mechanism to protect ourselves. But I think it is truly doing the opposite, right? Because we are lacking empathy for the people we are dealing with. We have a lack of knowledge too, myself included, because how few client experiences are we seeing published in the research? Very, very few. And I have not, I might be wrong, but I have personally not seen any specific to veterinary medicine. I've seen in animal welfare, but I have not seen any studies specific in veterinary medicine looking at client experiences in the veterinary clinic in the exam room, right?
Oh, yeah. Yeah, this is so interesting. So, thinking about what doesn't get published and where we're not focusing attention, and for the need for more qualitative research in our field. You cite calls in the literature for qualitative research to better understand specifically culturally competent or culturally responsive veterinary care and social justice issues in animal welfare. Where do you see the most urgent or underexplored questions that qualitative research is uniquely positioned to answer?
Honestly, everywhere, which is kind of a cop-out question, but again, we don't know what we don't know because we have been deciding what questions are important and not allowing a platform for those deliberately silenced or preferably unheard in animal welfare, right? What do underserved communities actually want or need from us, not just what we think they want or need or what we can provide to them, right? I'm a board member and have worked closely with Animal Humane New Mexico for years. And they launched their pet resource center and they were very intentional they already had programs going, but they were like, before we start bolstering programs, right? Let's do a community needs survey. And that showed my own blind spot because I was going to say, oh, yeah, they're going to say they want more vets, which is
Mhm.
a very hard thing to do, especially in New Mexico. But majority of people said we need access to pet food. Like I was personally shocked. Again, I knew that was a need, but I didn't think it was higher than veterinary care. So we weren't even meeting the basic needs of our community. And that is low-hanging fruit in
Mhm.
comparison to like hiring another veterinarian, hiring technicians, opening more hours. We were like, food, yeah, we could do that, right? And again, that was our own blind spot. So again, like how can we help make the communities we serve feel seen, feel heard, feel safe? And also, how can we restore trust in these communities that we have historically and in a lot of cases continue to harm, right? I think, yeah, again, everywhere, right? How are people responding to our services? Where are we falling short? Where are we causing harm? I think there are innumerable places to start implementing this research methodology.
That's great. You don't know how many technicians I talk to who are multilingual who will say to me, yeah, like they don't want, they're not sending me to the community college to like learn medical Spanish or learn medical, like medical terminology in this language because they say that, my clinic says that they don't see clients who speak that language coming through the doors. And it's just like, it's the other, I always say, like, it's the other side of that. It's that they're not coming through the doors because there's no one there and they're not advertising that there's someone there who speaks the language and can help. And they're not hiring people from those communities. So of course, no one's coming. So
Yeah.
like, if we don't ask those questions, then we're just assuming that people aren't showing up, but they're right there. When I look at, the census data for your community, this proportion of people speak that language. So they're clearly, on a business side of things, I'll say they're clearly missing out on the business that this community could be bringing into their clinic. And
Yeah.
and by not supporting you as a multilingual speaker and providing interpretation and translation, that's a whole community that might not be being, it's going elsewhere, right?
Yeah.
So
And it's
such a
very easy for us to assume, like, I'll take Albuquerque, for example. There's a very large Vietnamese population. It's very easy to say, well, they're not coming in because they don't value their pets, right? It's also very easy to make a negative correlation in that way too.
Yeah, yeah, absolutely. I want to make sure we get to the Q&A before I ask any other questions. And I see that we have at least one question here so far. So folks, if you have any other questions for Dr. Jafarian, please feel free to put them in the Q&A. This question here says, I think there's a perception that quant research is clean and easy and valid, and qual research is messy and hard and not worth doing. Do you think some of those perceptions underpin and could then be self-replicating, I guess, some of the intersections of epistemic violence?
I love this question.
Good one.
Oh, I knocked my own camera, sorry. I think that is very, very valid, right? Like I think what we know and what we have done historically is comfortable, right? And again, like my own mentors at Penn, Dr. Watson has a PhD in education. She has published in Qual with some support, but she had that support, right? So it's not both this like perception of what quant research is because majority of people in vet med are doing quant research, right? So I also think it's a stereotype and becoming this quote unquote norm that it is clean and easy and valid. Like for me personally, quant makes me sweat a lot more than qual just because I have more experience in qual and I have done work in qual and I've been mentored in qual. So that feels easier for me. And I think that's valid for everything we do, right? Like I will spay and neuter all day, but you ask me to fix a fracture and I will walk away slowly and find someone else to do that for me because that's not where I'm experienced and that's not where I had mentorship. That's not where I had specific training, right? Um, I wouldn't say one is messier or hard than the other. Again, I think I totally agree that it is self-replicating because, again, not many people are doing it. There's not a lot of mentorship, there's not a lot of guidance. Even with the experience I had coming into this PhD, like, same thing, like that Dunning-Kruger effect, where it's like, the less you know, the more you think you know. And then the more you know, the less you think you know because you realize how vast it is. I definitely had that experience where I was like, yeah, I got a great handle on this. And then I was like, oh, I know nothing. But that's also okay, right? Um, I definitely agree. And I definitely agree it could fit at this intersection with epistemic violence and silencing because I think both the field, again, this is broad generalizations, but generally we're not experienced, we're not doing a lot of qual research, but we're also not interacting with marginalized and underserved communities much. Like we had a conversation earlier today, right? That like there's at least two papers that show that veterinary students are afraid to go into underserved communities, and that is a major barrier. And bre all breaking that barrier required was just taking them, right? Having a great community engagement program that is culturally responsive and is working with the community that has community partners and just bringing students with you is sometimes all they need. Obviously, that's two papers, but that's showing us evidence that just that experience is what is needed. And the students were like, oh, whoa. these are people and they're not scary and they love their pet just like me. And, you know, I remember specifically one student wrote in the paper that I wrote about this was, this woman was talking about they were in a home visit. This woman was talking about, oh yeah, I take my dog out on an hour-long walk every day. And the student said I had this like shocking moment where I was like, when was the last time I took my dog out on an hour-long walk? Like, who am I to judge anyone, right? Um, yeah, but a great question. But
Yeah.
I totally
Reminds
agree.
That reminds me of that episode of The Pit for anyone who watches, where one of the doctors takes Dr. Ogilvy out to do some street medicine, and he has this like epiphany in that moment. We're very hopeful that folks who are afraid of street medicine or afraid of community medicine will give it a try and see how incredibly meaningful it is. I see another question here in the chat. It says, do you think there are some qual methods that would be a good entry point for qual researchers in vet med to sort of ease folks or readers in?
That's a great question as well. I think staying away from the really in the weeds methodology. So I would say stay away from things like grounded theory, because that is where you are essentially doing qualitative research to develop a new social science theory, right? So that is very in-depth in the weeds. I would say things like ethnography, feminology, those are very, very specific, very in the weeds. Not that they're not doable, but that's not a place to start. Um, Content analysis, which was what the methodology I used for my two pen papers. I would say that is a great entry point because it actually in a way is a bit of mixed methods. It's like a gentle mixed methods because you're not doing a full statistical analysis, but you are looking at aspects like, for example, my paper was the first part of the paper was what aspects of this robust community-based shelter med rotation was most salient and impactful for students. So a big thing we did was just quantify how many times they mentioned things. How many times did they mention surgery? How many times did they mention behavior training? How many times did they mention community work, right? So part of that was just quantifying mentions, which again is that's not very complicated to do. And then taking that quantification of what was most important to them and then doing that more thematic analysis of what about that was impactful, right? Like one of the biggest mentions was physical exams, which is like really shocking in a shelter setting, but the big thing within that context, right? So we had the number of times physical exams was mentioned and in what context. So what themes around that. And the big thing was spectrum of care, right? Learning how to do an in-depth physical exam when we were at Penn, right? So when you don't have MRI, when you don't have CT, when you don't have ultrasound. So doing that in-depth physical exam and being able to walk through spectrum of care and making a plan with very low resources. So I would say content analysis is a very easy, quote unquote easy, relatively easy in to start understanding things. And I do have a great paper for starting with qualitative content analysis that I'm happy to share as well.
Wonderful. Yeah. And for folks, I will be sharing out some of these links that Dr. Jafarian mentioned in the following email. I don't see any other questions in the chat. So I have a couple of closing questions. I might combine these last two questions together. So prepare your answer, and then we'll close out because we're getting close to the hour here. So two things. We're having this conversation at a moment when DEI initiatives are facing significant political and institutional pushback in many parts of the country. how does that climate affect this work, right? What's your message to veterinary professionals who believe in this work but are navigating hostile or skeptical environments, particularly for those people in academia who might be doing research and navigating those environments? And then last but not least, this webinar is called Beyond the Page for a reason. So we ask this of every author that we interview. What's one thing that a veterinary professional can do differently or do immediately to take the ideas in your chapter beyond the page, haha, and turn them into meaningful action in their own community? And those might be the same answer, they might be different.
Yeah,
I think
yeah.
that's
I would say, I mean, I'm definitely not going to pretend like this work is easy or that I haven't faced serious repercussions doing this work. I actually recently lost, I am still working as a relief vect, and I recently lost contracts over this work I did, right? And I have a lot of frankly fear over publishing the work I'm doing in my PhD. And I have wonderful mentors here who have never discouraged me. They're very encouraging, but they also have started that conversation of we need to start thinking about how we're going to keep you safe when this comes out, right? And I think it's important to acknowledge that the harm and the fear is very real, right? The threat is very real. But I also want to say that anyone doing this work, that you're not alone, and this work is very worth it. When you're doing this work out of love and liberation, you will see these small moments of incremental change, and they make it worth it to me. Like anytime I hear someone reassessing their previously held beliefs or someone that asks, hey, could you share that paper with me? Or hey, can we have a deeper conversation of this is really impactful. And seeing someone doing the work fully, humbly, and respectfully is really rewarding. But the most rewarding moments for me are the moments of community, the ones that have supported me throughout my endeavor, my endeavors, the endeavors of MCVMA. I use this example a lot of, the first year we had RISE, our MCVMA conference. For those who are not familiar, it was the only and still is the only veterinary conference where all speakers were BIPOC. And remember that first year, Melody, we had a Zoom call with all the speakers and volunteers and MCVM board members afterwards, and people cried. People were like, this is, and some people were at, 10, 20 years, sometimes more into their career, and they were like, this is the first conference I've ever attended, spoken at, where I could be my full authentic self. And that is worth it, right? I think often what it would have meant for me to have those resources to see this work being done when I was a pre-vet student, when I was a vet student, and that's what motivates me, right? Like providing that hope and that resilience to others like me that are going through it. Um, and as far as what one can do to take these ideas, right, and turn them into meaningful action, I think a big thing is like start reading qualitative research. Start reading it inside of vet med. It does exist, it's there, and also outside, right? Start with human medicine and branch out. Social work, but I'm biased. Sociology. Adelia James is a phenomenal sociologist that does a lot of research at the intersection of race and veterinary medicine. Um, all of her papers I would highly, highly recommend reading, right? But also to learn to be a critical consumer of all research. Ask those critical questions when you're reading it. What does the author want to know here? Why was it done in this way? The methods they use, do they make sense? Do the results make sense, right? How did the authors interpret this? Does the interpretation make sense? Because we do have a problem with research in vet med too. I'm not going to ruffle any feathers by mentioning a paper in particular, but there's a quant paper that came out a couple of years ago that changed the way people practice. It was like a big, big thing when it came out, but when you actually read the paper, the authors openly admit to throwing out a huge portion of patients to make their results statistically significant. So they openly admit to manipulating the data, but people are still changing their practices because of this paper, right?
Wow.
So being a critical consumer of research is important too. And I would say finally, because I see we have 1 minute left, I would say those Fisher-Bourne et al. Questions to ask ourselves, to ask of our institutions as well as an aspect I didn't get to talk about is a really great way to start looking at things, at everything we do with a more critical lens, right?
Yeah, wonderful. Well, thank you so much, Dr. Jafarian, and thank you everyone in the audience tonight for joining us. We want to again thank Maddie's Fund for sponsoring this webinar series and for sponsoring open access to the Elsevier uh, works, articles that the series is based on. You can find those articles on our website, so you can read Dr. Jafarian's paper that this webinar was based on if you want more of that information. If you want to see what some of those cited resources that she has are in that paper as well. I've also, before you go, let us know what you thought of this event and what you would like to see us discuss by taking an anonymous feedback survey, which is in the chat. You can open that in your browser. It should only take you about 2 minutes or so. We'll also send it out via email. And we also would love for you to keep an eye out soon on the next Beyond the Page webinar. We'll be announcing it soon. So if you're not already signed up for our newsletter, that's the best way to stay in the know. The link to sign up for our newsletter, it's free. We don't spam you. We send something out maybe once a month with resources, including papers. Our newsletter now features what we're reading. So we're actually reading a lot of qual research. We're in both in veterinary medicine and in human medicine. And if you sign up for our newsletter, you get a look at, like Sohaila and I are always read what you're reading because you're in your PhD program. I'm reading because I'm a huge nerd. And so we're always reading things and we're including those links to open access resources in our newsletter that talk about a lot of the issues that we talked about here today. So thank you again, everyone, for coming. Oh, I see someone says what we're reading has been one of my favorite parts of the newsletter. That's such
That's
great
so
feedback.
satisfying. Yeah.
That's so satisfying for us. We're like, are there other nerds out there who want to read research papers? I try to read at least one every Thursday. And so, yes, absolutely. Sign up for our newsletter. You can hear about our events. You can see what we're reading. You can come out and meet us if you're at certain conferences. We'll be at AVMA convention in July. So, yeah, just stay in touch with us and keep an eye on this particular series. We usually do it every single month and have a new author talking about really important issues in vet med that relate to animal welfare, DEI, supporting communities, marginalized communities, and we'd love to see you all there. So thank you so much for your time. I see a lot of thank yous and appreciations here. I know it's getting darker where I am, so I know that it's probably dark for some of the folks on the East Coast already. So I see a lot of appreciations and thank yous. Thank you everyone for coming. We really appreciate you.
Yeah, thank you, everyone. And my contact information is on the MCVMA page too. If you have any questions, want to chat, anything like that, my door is always open.
Wonderful. Thank you everyone. Have a really good night.
Night.